Welcome to today's edition of The Chat with Ibra. And today's edition, I've hosted a doctor. I've got it in people power, but it is not, it's not people power. I have Dr. Trevor, Women Wellness. And of course, today I want to talk about something that so many people have really ignored. Nenga, chilimu buli sawa chigenderamu. Dr. Trevor nakusimire.
Wanyala.
So kwa chese kwa kuona nion and introduce yourself.
I'm very glad to be here.
Yes.
And greetings to all of the listeners out there that are listening to this program or this show.
Yes.
My name's I am Dr. Trevor Mayoka, and I work with Women Wellness and Family Clinic. Enga abere yo yaya wose yanangako, and he asked me to come and talk about something that is very vital.
Yes.
Which bothers a lot of people in the communities, but they don't have a lot of knowledge on this.
Okay, I think let's start from there. Dr. Trevor, if you've been really keen.
Yes.
Abamu sako zesu kugendera munzu be I think almost 8 out of 10 but besu kwa nini nabo udi abasombewa ni gamen. They have dental problems. Either ulakugana kuza lisino limuzina alini kutusamu lisino lilimo chiro lisino li basically the amalire ku mirembe wameno goza nagasanya dala. And of course if you look back at the years when we were growing up, this wasn't really so common. What do you think is the cause of all this? Udioti buli muntu kuba tuli kumudyanga batu nga 8 7 bakusombe bameno.
Well, chinyoelako, you have to understand the lifestyle that we are living.
Yes.
And also the issues vyegameno, there are more dental or vitu vyegameno.
Yes.
More dental issues these days than there were those days. One, I would say because of the lifestyle. You do realize that these days, most of the things that we take into our diet are processed. And we don't have this local training in our children when we are upbringing them in our families about certain things or certain meals and diets. So, for example, something which is very vital mumeno is calcium. Magumba, that bones,
yes.
I would say.
Yes.
So calcium is very vital for bone development. But you'll find that from a very young stage, children are eating gorillas, they're eating cornflakes, they're eating sweets. So most of 80% of their diet is not having the necessary nutrient for proper development of their bones and teeth. Another thing which is vital for the teeth is, I would say, fluoride. A low component which we call fluoride, which is present in water, in the water that we take, if it's tap water, but at a limited or a very small expense.
Okay.
Now, this fluoride can also be found in toothpaste, it can be found in foods like greens and other food nutrients. But you will find that because of the coming of other diseases like typhoid and so these days, they don't allow their children to brush their teeth with the tap water. They don't drink tap water anymore.
Yes, yes.
So we are drinking bottled water. And in most cases, bottled water, they ignore the fluoride. They don't have that high component of fluoride. They instead put chlorine.
Because you see, I was actually going to come to a question. There's back then, watu kwa sita meno, really, kucharo mtu sodianga ni muswachi wani babagaga kucharo, because they didn't have all these problems. And okay, let's go on.
So we're trying to get the lifestyle and the we call the epidemiological predisposition.
Yes.
Nenga wezile causes are first-hand things. Things like how you take care of your teeth.
Yes.
How many times, for example, do you brush in a day? You as Zebra?
I think twice.
Twice. Why?
Because you see, I wake up in the morning, ni singa, nasita men, natulayo neza kuyiriba. Then eswidira mu brushing achiro ngiga widide ugana kuzagona.
Yes, yes. If I told you that the brushing in the morning was not necessary. Because wamakudya china mudike wasene
buzibu nga wenyukire mu dikini this mouth is never the same kasita mu dikini.
If you have ever brushed in the night before you sleep and you wake up in the morning with a smelling mouth, then you should know that you have another dental problem.
But of course you can you cannot actually know oba okunya mukana until somebody else tells you okunya mukana.
Now
it is really very very rare umuntu kukolomera ati okunya mukana kubanga someone is going to feel like uza kuba offended unya munyigira ndikumunyigira ngakoma okunya mukana, so sometimes you may not get to know. So I think I'm just getting to know right now.
Now, ideally, you're supposed to brush after a meal. Ideally.
Yes.
Nenga, if you cannot do that, because with the recent developments, you can eat a meal even more than 8 times a day. So ideally, at least after every meal, you have to rinse your mouth with water.
Okay.
After rinsing your mouth with water, if the meal included something like a meaty substance or a fibrous tissue, when you go flossing, you floss those components out of your teeth. But rarely do we do that. Busala, they are not advisable. Busala buza kuonekesa your gum chivuno. When you're pricking the substances, you're also pricking your gums, which also predisposes to other dental issues. But mainly the main point is after every meal you're supposed to rinse your mouth, and then if it is a meaty meal or a fibrous meal, oniko flossing. So you realize that most people do not know that. After ngadile video bye azakuza atibu kabuleta busy bumeno obuchina, they want food. So there are those micro remainders of video byesudileko which remain on your teeth, and the germs that cause dental caries or dental issues, they feed off that.
Now, my question is, kwaganikire ku video besi kulezina kuzi mezi gesi kunywa gesi kuesa kusita meno, you realize that you cannot avoid it at the end of the day.
Yes.
Konyacha avoiding ada. Umuta akola atienda. Before we get to the other point where we talk about the medical bit of it, meno gakolega tinzena. To avoid all these, we've talked about co-brushing.
Yes.
If you've not brushed, you rinse your mouth after every meal. So now, what do I do? Kuboneti meno gange kagaba affected in this process, because there are things that you cannot avoid, Trevor.
Yes, I understand.
Now, what city they must set up is kwenda ezina kuzi. Umwana akukula bitwesa ali kukulirako automatically kona suso mana kudi ice cream ne. Kona suso mana kudi biscuits da. So what do we get to do kutereza buda mukula kuona bana niga meno da.
Ati ideally akaba wo muntu mukuru.
Yes.
Kuba kunya kwaga nikakubana, because for them their teeth are still young and underdeveloped, and they are more at a risk. Nenga even you an adult, there are some things you can't avoid because you can't brush after every meal. However, there are things I would advise that would at least prevent you from getting consistent dental issues. I think the biggest dental problems we have in the communities are, one, sensitive teeth.
Yes.
Sensitive teeth which are brought about by plaque. Kulanga kuti plaque oba buchafu.
You're brushing your teeth nengo kuuliranga meno galinga gakusanya.
Sometimes not even brushing, you take something cold, you feel your teeth meno gazini, udyako chitu chikafu, you feel your teeth are paining. You can't take in cold, you can't take in warm, you can't take anything hard because your teeth are sensitive.
Yes, and
that is brought around by something which is called plaque, which is like a dirt that collects on your teeth. And then when that plaque collects and takes long enough, it develops into a hole. Those black lines you see, they develop into a hole, which is a dental carie. At dental caries is ochina. When that hole reaches the part kumenes kulanga kuti pulp cavity, that is the sensitive part of the tooth. Nikela kufuna signs, but before that you don't have signs that I have a problem with my teeth. You start getting the signs after the what?
So I think we talk about
so now
at the same time what is the solution to that? I think most people have that.
Yes. So now to be able to solve this, like you said, to be able to avoid this, you would have to know the do's and don'ts of teeth, the things that you need to do in order to avoid plaque. So plaque is simply accumulation of dirt or food particles that remain in your mouth and accumulate over time, and you cannot brush out plaque. And even the style of brushing should change. I expect that after this conversation with you, Ibra, your brushing is not going to remain the same. You are smiling.
Wait. Brushing and I styles.
Yes. Most of
because
us,
you see when brushing and brushing and brushing and brushing,
that is not the correct way. Even the toothbrush you use, the toothpaste you use. Actually. Okay. So let's start with brushing.
Yes.
What kind of toothbrush should you use? How long should you use that toothbrush? Mu community bakolesa bisala. Others prefer, hard toothbrushes. Others prefer this, others prefer that. Whatever toothbrush you buy, things have been made easier. That now you regulation boards like UNBS, which regulates some of these products which are used for daily use. So if a toothbrush is regulated by UNBS and it's past 10 years, it should be safe for usage. However, not more than 3 months.
Even if it is not damaged anyway?
Even if you look at it, but of course, before 3 months, you will see that toothbrush is damaged. But even if you look at it and it's still usable, do not use that toothbrush. It is beyond its usage. But you'll find that most of us use the toothbrush until it is starts to, and then that's when we shall dispose and get another one. And then another thing is the toothpaste that you're supposed to use. You should always make it a habit to read on whatever you buy, especially if it's going into your body. So the toothpaste that you're supposed to use, the toothpaste should have fluoride in it.
Fluoride.
Because that fluoride is a component that strengthens your teeth. Or the top layer of your teeth, which we call the enamel. So with the consistent use of that fluoride, that enamel hardens and becomes more stronger, and you can avoid these holes or this plaque from digging into your teeth. Now, the style of brushing. How do you brush? But when they're brushing, they go left and right. Or this side and this side.
And then the tongue.
And then the tongue. Very few they brush the tongue.
Hey, at least
and you will find that is not the right way, because you see the teeth, they're standing like this.
Yes.
So if you're going left and right, you're simply pushing food particles in between.
Inside.
Yes. So the top will feel clean. It will look clean, but there will be food particles stuck inside those lines.
So what is the right way?
The actual way of brushing is in circular motions.
So it is like
circular motions. It's also not up and down. Other people believed it was up and down. But still, you see the gum, you'll be pushing food into the lining of the gum. So it is small circular motions, and you don't have to use a lot of energy. Even people believe you use a lot of energy to make it cleaner. No. You just gently and not so smoothly, but with some force. Secondly, nemugati mwega men. Carbon these teeth, they're not just the top part. There's the inner part. A few people brush the inner part. So you also have to brush the inner part as well of those teeth.
Now, I think that is where the problem is. Most of us, we concentrate on the outside, the top, and the tongue. The top.
Yes.
And you are done, not the inner part.
Yes. So as you're brushing in your circular motions, you brush the inner part, and then you brush the tongue. And after brushing, you make sure you rinse your mouth.
Now, I think let's get to the more sensitive bit of it, of the interview. You see, I want us to look at people whose teeth have been affected already.
Yes.
People get a lot of problems in that case. But of course, before we get to that, ladies and gentlemen, bakukuba namwe sizana chalero kwa shooting ku La Shalom Hotel. La Shalom is a hotel by any accommodation, and sometimes if you want to, life is very short. Can come here and
you have to enjoy life.
Yes.
At a certain point, you have to.
Yes, can come out here for a date, a meal, or a sleepover, whatever you want. It is La Shalom Hotel along Mugisu. It's called Mugisu Hill. This is Mugisu Hill.
Oh, Mugisu Lane.
Mugisu Hill. That is where it is. So pass by anytime. So now, let's consider the but I've had people close to me bafune bizibuni gamen. Mutaza but bari feeling but baze kuri feeling alisi no.
Yes.
Bari feeling akatu kamara katulamu kesi muri gisukura nkuti cement for muri gisukura cement. Bakamara katulamu uraza bam karalisi no bam kula muri sino kandi kamenyekera mu and then it becomes a very big problem. Uraza meno gene bakura still bachikura. Imagine meno gadatu and then you go back and they want to remove another one. One, let's start with the treatment of the teeth rather. Is it a must masino oba at what point this is nobody could
So ideally, I will start answering by saying everyone by the age of 20 or 21 should have had a tooth problem.
Yes.
Including you. And I'm sure even you right now, you must have some tooth problems.
Yes.
That is the seriousness of the matter. Now, treatment depends on the condition of first things first, you should know that it is a must supposed to have a dental checkup every 6 months.
Okay.
You don't have to wait. In Uganda or in Africa, we have this habit of waiting until the problem actually happens before we go and check. But I know you have a car. Don't you take your car for servicing before you travel or what? Yes, you don't necessarily, it doesn't have to be having a fault, but you just take it to service to check if there could be underlying faults that have not yet been noticed. Same thing for your teeth. There are things that you will not you as you know, but a dentist will know. When they look into your tooth and they will tell you now this tooth, it's developing plaque and it's going to develop a hole, which may be too late and you'll have to remove. So it's not always the solution of removing, and it's not always the solution to fill if you catch it early.
Okay.
But if you catch it late, that will be the solution. So for example, you come to Women Wellness and Family Clinic, our dentist will look at your teeth and then we'll give you a general, first of all, we offer free dental checkups.
Hey, free
dental checkup.
And then you say, checkup after every 6 months.
Yes.
You're starting with me.
So we have already cut that. You know, people fear going to hospitals because they fear expenses.
Expenses, yes.
So at least the checkup will be free.
Consultation fee.
Yes. So we have eliminated the consultation for dental checkup.
Okay.
Yes. Kind of giving back to the community and making sure people are safe. Now, when you come to Women Wellness, we shall check your teeth and give you what you're supposed to do. Okay. For example, if your problem is requiring just scaling and polishing, put some plaque to remove the dirt which has accumulated. We shall tell you need to scale your teeth and polish them. They will even show you pictures of your teeth and it's beautiful. You'll see how
that is free.
You'll see everything happening.
That is free.
The checkup is free.
Okay.
Yes. And now, after doing the checkup, you will need to do a procedure for your teeth. So amongst the things that you need to do, you talked about kutsamumeno, like uprooting. Uprooting, we usually do it when there is a hole in the tooth. And that hole has gone past the pulp cavity. Now, when that hole has gone past the pulp cavity, there are two options. There is filling the hole, which is not a permanent solution because with the time that sodium amalgam over the cement, like you called it, it keeps wearing away, and sometimes it can come out depending on where you put it from. If the person who put it did not put it well, it can come out. So one option is filling, and then the other option is removing the tooth, which is the more permanent solution.
Well,
dental syringe
I know that they're really very. I think
tiny and less painful.
I have phobia for pricks,
for needles,
anything. So, but at what point you said in a very feeding, but then you see But bagali kisinga kubalemesa ku refilling as a midwaliro, and it is extremely too expensive in most cases. Ndasiri dalma kenze ngume ninacho bakikola kino bachinzi takikola kino
chikwete
chinzite. How expensive is it ku refilling?
I would say refilling is roughly affordable. Between depending on the size of the hole and the location on which tooth, it could be between 50 to 60,000.
Hey,
refilling.
Okay.
It should not be expensive, but kutsamulieno is cheaper because an extraction can cost between 30 to 50,000, also depending on the size and location of the tooth. But why should you? The question is, why should you refill, or why should you remove? Because you will go somewhere to refill and they will tell you this one you can't even refill it. We have to remove and put an artificial tooth, which we also do when the hole is too wide and refilling.
Artificial tooth yo inyana yalu ligumba kuba batu banyanya ndio muntu akunyanya agana kunyanya ngo kaini kunyanya
disadvantages ze kulinda kufa ni nachonga no lomeri. You know, as you take time, you wait, the problem becomes worse and worse.
Yes.
I think I chore the kuta mu dentures or artificial tooth with warning ngawatele mu bakuwa warning. Some of them are more permanent, by screwing them. Some of them are, temporary dentures which you put and remove. Ngoza kugona, or when you're going to eat something hard. Now, in cases of dentures, we give you with warning. With this denture, do not eat something hard. With this denture, do not do this. This denture, do not do this. And dentures are expensive. Or what a normal person would say, would say, dentures are expensive.
Very, very expensive, yes.
The same thing with braces. But instead of calling the warrior with the expensive part, go check up. When you go check up, know what your problem is, and either you decide to remove the tooth or to fill it or to scale and polish it. Because it starts simply as, plaque, that yellow lining you see.
Yes.
You may not know that it is plaque, but when the dentist sees it and they know it's plaque, it just starts like plaque. But once it cements into the crack, they are becoming a black, and one of those black things. Very soon it will become a hole, and very soon you need to remove.
Now you talked about, are they called bracelets?
Braces, yes.
Braces. And lately it is more of
cosmetic.
Yes.
Looking good.
Why as was it a condition in?
Braces are used to correcting a man. Now do about two and men gali not in the right format. They are not sitting well or looking right. Gali ni traffic jam. Braces will correct your teeth and they will have the perfect dental formula. So if you have your money or if you're a celebrity, why not do braces?
Not all celebrities have money, but
celebrities care about their outlook. They care about the outlook. Most of them.
Money is the biggest problem. So now, mugasogwe braces zochi nakuteleza meno gide position indwele.
Yes. Ngabone kebula inga wa smiling ile kaka na kalio kala makati. Oh, this guy has a perfect
because now it feels more like alio babajifurange design. Because ngatele bulesa kujenda agana bazibonenga.
Now you see, with the communities have different psychosocial, statuses.
Yes.
Because braces are expensive, people use them for, like how you can be in a school. And for us, when we were in school, when I was in high school, there were shoes that were only for expensive kids. There were watches that kids. Only us planned kids would have. Even the showering soap. So it's something with general communities. You'll find that the braces, all general braces are expensive, but there are those even that are more expensive, like gold braces, And you find someone has put gold braces that are doing both correcting the teeth and showing that they have the money. You understand?
They are doing the same job.
However, I think we have among the cheapest braces in the area, because our braces start from 800, 900, But you will not go somewhere and you find braces at 800, 900, the whole procedure. Yeah, you'll find that doing it at 2M, 2.5. So it's a matter of whether your problem and the money that you have, it's your worth. Your health is your worth. These days, you will not go to a government facility. I'm sorry to say this, but you not go to a government facility and they put braces in your teeth.
Okay.
Because they will not have them. They are not
Won't
there.
they tell you to go and buy?
Even if they tell you to go and buy, they may not have the necessary equipment, to use. And after putting braces, you have to go back for checkups every month. So
braces
braces are for 18 months. After 18 months, you remove your braces and you have a perfect smile.
Okay.
And also another thing why braces might be expensive is because all these other things are done. If you have plaque, it has to be cleaned when they're putting those braces. If you have if you need scaling, they will do it before they put the braces.
So I think the other biggest problem would be what kind of toothpaste would be. I know unyaraga kuchingira munabyo na kunyonyola. You see, the toothpaste to the market. Omogari.
Yes.
And buliwe is his style of marketing. Because kuamba katale kabatu bagule, there are things that you need to come up with. Baka designing ile budai oba kolele binano, and then people you go in for that. And you see, toothpaste ne mudweragana sometimes niyo kuletera bunano kuletera buzibu. So how are we going to handle, because you said it needs one toothpaste omulai wesu ni kwesa aine kuba ni fluoride. Yes, fluoride rather. Banawandika ko fluoride, but at the end of the day kenza kumanya china chiri munano chiri mugachira. And these are the same things that are bringing problems to the people. Omuntu amanya ati toothpaste mutufesi ni kwesa eyuka inyo mutufesi ni kwesa
ati wabone. I wouldn't want to mention brands because having spent some good time with our dentist at Women Wellness,
yes,
with the more time he would tell clients certain brands, they would feel like he's marketing, those brands, and they would say, the doctor of Women Wellness told me use this toothpaste and they stick on it. People are weird. They told me use this one. I want this one. It looks like a marketing strategy. But however, if you read on it and you see fluoride, and like I told you, the regulatory boards.
Yes.
But I can give a few number of brands that are more common in the community.
Yes.
You've heard of Sensodyne?
Yes.
Yes, Sensodyne is used by most. It's actually recommended by most dentists. Wawulira Colgate. Yes, Colgate is more recommended also by most dentists. I can't mention other brands because I'm not sure about them, but mostly those two are the ones that are most recommended. And then the funny thing is you'll find even within those toothpaste, there's a mentioning mulimu brands. Unadia toothpaste wa Chako, unadia toothpaste Habo, unadia toothpaste.
Exactly.
So now use, unless you really have a problem that needs that specific, maybe Habo what, just use plain toothpaste.
Okay.
But it's a preference. It's a preference of someone.
Kali. Dr. Trevor from Women Wellness and Family Clinic. Also, I think amaganika ku dental bit of it mukolani gameno teleza meno and cases
everything
but I think before we get to leave, give people a few details about Women Wellness and Family Clinic.
Women Wellness is a clinic. It's found in Indian Quarters,
yes, Mbale stores, yes.
And I think we do all services, not just about dental.
Because you see, when you talk about Women Wellness, someone is like, okay, so
those are women. No, it's and family clinic. So yes, we handle actually even men. And at a certain point, which is a funny fact, at a certain point we had more male clients than female clients. Can you believe that? So we handle majorly all general conditions, yes, gynecology, pediatrics, and antenatal care, dental, scan services, everything. However, it being a women wellness and family clinic, our niche, or the people that we handle most, or we started handling the most, were women and children. So we had a specialist for women, we have a specialist for children, and that's how the name women stuck.
Okay.
And we decided to carry it on, but even men as well, we handle them perfectly, and I've had male clients that have handled perfectly and they're okay. So I would advise that if you're a man out there and you're listening, please do not fear the name, just please come at any time of your convenience.
Okay, if somebody is watching this video, any question, I think I'll put up the number.
You'll put up the contact, yes.
Contact up there for people to get to see and reach out.
Yes.
And yeah, and then finally, as we wind up, I think next time we're going to talk about the number of things that we need to talk about. A little bit to be basically ignoring. Last time I had Dr. Emma back in STDs and UTIs.
Yes.
And I received so many messages, so many messages. Some asking for Dr. Emma's personal number.
Yes.
And then the number of things that we need to look out. Next time, sawa zile za clinic kuza kujanjaba. First thing they are going to tell you, you have ulcers, you have typhoid. When we get back next time, I think we shall talk about that. But for now, what are your last remarks to people that have been watching?
I'm very glad to get this opportunity. By the way, most people do not know some of these things.
Yes.
Even the brushing and the rinsing your mouth after every meal. It has something small, but it can save a life.
Yes. Because
something to do with dental can cause heart problems. I think that's something I've not mentioned.
Sure.
Yes. Sensitive teeth can be a sign of a heart problem or a sign of diabetes, which is a much worse, bigger problem. So the biggest challenge we have in the community is dental issues go on unnoticed for a while until it's too late. So what we could be saying or what we have been discussing could have saved a life. And I'm proud of that as a doctor. I'm proud to help people. And like I said, I work with Women Wellness and Family Clinic,
yes,
located in Indian Quarters, Amber Stores. I could mention our contact if you don't mind. It's 0393 254 690. I repeat, 0393 254 690. And that contact is on anytime.
Okay.
So like I said, we offer free consultations. You can call anytime.
It's free consultation.
The doctor will be on.
Kale.
When you call anytime, the doctor will be on.
Kale, thank you so much. Subscribe to my YouTube channel, The Chat with Ibra, TikTok, Source Ibra. Wanyana Dr. Trevor Kwez.
Wanyana.